Do you find with the electronics it makes the patient more interactive in their own health? Instead of just saying, here, this is what it is, they actually have to write down or type in what they're feeling, what's going on, their past history, what my family history is, and actually be more participatory in it.
Yes, I think so. And even in terms of the internet, when you can go on the internet and pretty much look up everything you can about the symptoms you're having, and you come in and advocate yourself with your physician.
Obsessed with my Google.
You don't have to obsess about
No,
it.
but well, here's because of where we are technology-wise. Years ago, you'd go to I'd come to you and say, this is what I'm feeling, please help me. I can, and goes back to what we said earlier, I can now come to you and say, you know what, I checked on this, and this is what the stomach pains are, and this is what I'm feeling, and these are my symptoms, because then I'm also very much a team player in regards to my own health.
Exactly.
Because I'm my best doctor.
Right, and sometimes, of course, we have to redirect those patients a little bit and try to get them out of thinking that they have, you know, the zebra diagnosis, that, you know, really this is just irritable bowel syndrome or something like that. But I love the fact that they look it up, and I love the interaction with being able to have an educated patient want to know more about what's going on with them.
Speaking of electronic record keeping, this brings us to another one of our viewer questions. How safe is my patient information? I think a lot of people are concerned that if their medical records are on the internet, some hacker's going to get a hold of them and spread the word that I had irritable bowel syndrome or something, you know, potentially embarrassing or something that could compromise their career.
Right. Well, there are a lot of protections for any kind of protected health information, and that can be anything from your name to your social security number to your diagnoses to your medications. So I think no matter what system you're talking about, whether it's the hospital system of the electronic medical record or a clinic system, there are protections that are put in place so that is as least likely as possible to happen. But, of course, even banks can get broken into and hacked into. So nothing is perfect. And what I always say to people is, you know, do you really care if people find out about your health information? I mean, in a way, if someone finds out that I had acne when I was a kid, oh well, there you go. Now, of course, you want to have your information protected, but in this day and age, anything is pretty much open territory. And I think the more people become comfortable with just saying, oh well, there it is what it is, and then you're going to be better off. But certainly we take as much care to keep all that kind of information as protected as possible.
And even with that, you don't want to dissuade a patient from withholding anything.
Right, exactly. Again, the more information we have, the more that we can help you. Yeah, and the more people want to get their information, so the more people want to see their lab results or responses from a doctor in terms of some kind of question they have, the more that's coming back to them, the more that is going to be exposed to people finding that information. And honestly, sometimes it's in a way the patient's fault that gets exposed because they left it on an email that wasn't protected, they printed it out and left it somewhere. So as the patient, you have to take responsibility for all of that protected information as well.
May I ask another question on behalf of our viewers? What are some of the legalities surrounding minors and their rights to medical procedures and private patient information?
Generally speaking, when it comes to minors, it has to do with who is paying the bill. And if the parents are paying the bill and the parents have the minor on their insurance, the parents can have access to that information to some extent. Now, every time we have a patient in our room alone with us, that interaction is as confidential as it can possibly be. Now, there are rules in terms of when we as the physician are required to state that something is happening. Like in a case of abuse, we have to state that that's happening and we have to report that. So there's certain situations where I will sit down with a patient alone in the room and say, if you're going to be telling me about this kind of an issue, I will have to report it. So knowing that, go ahead and tell me what you want to tell me. And sometimes that's a good thing. And believe me, most of the time they're going to tell me anyway, and we're going to get them the help they need no matter what. So I would say in that kind of situation, it's always better to say something because we're going to be able to get you what you need.
Dr. Miller, I know you have a lot that you want to tell our viewers about heart health. February is Heart Health Month. Stay with us because we've got a lot of information on how you can help fortify your body's hardest working muscle. Welcome back to Healthline, and we are talking to Dr. Katrina Miller, our family medicine doctor from Glendale Adventist Medical Center. We've been covering a wide range of topics, but now we're getting to a topic that is close to all our hearts, literally. I'm wearing my red jacket for Heart Health Awareness Month, which is the month of February. We also just had Valentine's Day. So, Dr. Miller, you like to tell your patients ways that they can keep their heart healthy. Tell us some of the things that you feel are the most important topics.
Well, I think the most important topic is do the thing that's easy for you, and that is, again, have a healthy diet, lots of fruits and vegetables, and try to stay away from the things that are unhealthy for you.
Such as?
That's pretty easy. Smoking, definitely stay away from that. High-fat foods, high-carbohydrate diet. So basically, if you're just staying with what I call a colorful plate, it's really easy to have a healthy diet. You want to stay with about five fruits and vegetables a day, and or 5 servings of fruits and vegetables a day to really keep up with what is recommended by the government.
And not all vegetables are created equal. I mean, if you're just eating peas and corn, that's not quite the same as eating cruciferous vegetables, the dark green leafy vegetables.
True.
And excuse me, I didn't mean to interrupt you.
It's okay.
You're so good,
It's just my little
Suzanne.
vegetable pitch, you know.
It's
So
very
good.
true.
Don't be afraid of kale.
There are fruits and vegetables that are very starchy, and they can be high in carbohydrate and actually increase your blood sugar and increase the likelihood of actually gaining more fat. So you do have to be careful with what you're eating and try to stay with, like you're saying, more of those cruciferous vegetables, more of the colorful vegetables, really. So, but basically, you also want to control things that you can control. High blood pressure, diabetes, high cholesterol. If you know you have it, keep it under control. If you don't know you have it, prevent it. So try to stay with a healthy lifestyle. Exercise, very important, easy to do. What is suggested is 150 minutes per week, and you can split it up however you want. So if you just get 10 minutes of exercise at a time, it can still help you. And if you lose 10 pounds of weight, just 10 pounds of weight, that can have a great effect on improving your health and your heart health.
I like that you said suggested.
Uh-huh.
Well, no, because a lot of doctors go, you do this, and it's basically an invitation to living longer
Right.
and taking better care of your health. Now, one thing I do want to say, if you do not take care of your heart and your health, and you are wearing red, you have red, my heart is my red, I'm going to add some statistics because I think statistics really let us know where we're at as a country.
Sure.
Top 3 causes of death for women: heart disease, cancer, and stroke. 1 in every 3 women has cardiovascular disease. 460 women per year will die because of that.
460,000 women per year will die.
Wow. And men?
And men, I think the total number is about the same. So about 500,000 men per year are going to die because of some kind of heart disease.
From your experience, why do you think, knowing what we know, we still don't take as good care of ourselves as we should?
I think it goes back to what we were talking about, stress and depression. I think, like you were saying, a lot of people self-medicate by eating inappropriately and thinking that not exercising makes them feel better, thinking that exercising is, more of a stress on their life than they think they should actually go through. And so they get sedentary. What makes them feel better is sitting down and watching TV, and so they don't want to get up and actually make themselves more healthy. The other problem that I find is actually unhealthy food tends to be cheaper. And unhealthy food can actually be found more easily than healthy food sometimes. I mean, how many, different kinds of fast food restaurants can you see on every street corner, and how far do you have to go to get to those healthy grocery stores where you can actually get not only fruits and vegetables and healthy foods, but maybe even organic, which is going to be more expensive and a lot harder to find. So, we have kind of a setup here for just being more unhealthy in this country, and it's actually spreading across the world too. And you can see obesity growing in other parts of the world where more of that fast food.
Over 40% of young kids and teens are overweight in this country.
Right.
And it also goes back to gaming, any type of media, and being on the internet. It's an international pandemic.
It is. It is. And Michelle Obama just came out today with her.
She was on CNN Live as well tonight.
With her program to try to help kids be more healthy and decrease obesity in children, which I think is great. Anything that we can do to try to get kids up and moving more, having a healthier lifestyle, which means a healthier diet and more activity, even if it's just activity. It doesn't have to be exercise.
Parents think turning on the computer and say, here, watch, is a lot more entertaining for the kid than actually going outside, playing with your child, and having fun. Because when I was a kid, that's what we did.
Right.
I was sent out with my brothers, and we were sent outside for hours on end. We were only given an hour a night of TV.